All right, welcome everyone. My name is Jill Rankin with the Wisconsin Institute for Healthy Aging, and I am so happy to have us all together today for our Age Well series, Staying Active to Prevent Falls. A little bit about our organization, if you aren't familiar with it. Wisconsin Institute for Healthy Aging is committed to helping all of us age well through partnering with many different community organizations, many of whom are with us today, to bring evidence-based programs and practices to our communities here in Wisconsin. So we thank our generous sponsors of today's event, as well as our speakers. I'm looking forward to bringing you some important health education information in preventing falls. So I'm honored to introduce Megan Tim, who is an important partner of ours in our statewide fall prevention work. So I'll hand it over to you to get us started, Megan.
Thanks, Jill. Welcome, everyone. My name is Megan Tim, and I have the privilege of working for SSM Health in Wisconsin. Welcome to today's conversation. SSM Health is a proud sponsor of today's conversation and a proud partner of WEHA in supporting our communities in staying healthy as we age, and in particular, safely being active as we age, and the privilege of actually having a lot of conversations around pickleball recently. So thanks so much for having us today and for being here. And I will pass it back to Suzanne to introduce our wonderful speakers today.
Awesome. Thanks, Megan and Jill. We are going to get started with our conversation with Alex Wagner and Carla Bach. They are from the UW Health Sports Medicine Fitness Center. And Alex and Carla are going to talk about the importance of physical activity. I do want to just remind everyone to stay muted while the speakers are talking. We are going to hold questions to the end. We have some time for Q&A at the end. So Carla and Alex, whenever you're ready, go ahead.
Hello. Hello. So my name is Carla Bach, and this is Alex Wagner, and we are fitness supervisors at UW Health Sports Medicine Fitness Center. And what we're going to discuss today is the importance of exercise and things you can do, strategies you can do to help you prevent falls, and then also the importance of balance. Next slide. So to touch on what is physical activity and exercise, many people probably think, well, what's the difference? Aren't they the same thing? Where they're a little different from each other. Physical activity is essentially anything that gets your body moving, that burns some calories, whereas exercise is kind of a subset of physical activity. It's something that's more planned or structured with the objective to improve your physical fitness or your health overall, such as running to achieve a 5K or maybe get better at pickleball or something like that. So it has more of a structured goal in the end of it all. So physical activity and or exercise, if performed regularly, can definitely lower your risk of chronic conditions such as stroke, cancer, heart disease, as well as improve your sleep, your mental health. And also, some people may not realize is reduce the amount and or need of some drugs that you need for those conditions. So for example, if you have high blood pressure, you could exercise and that would help, maybe not force you to take medication for your high blood pressure or reduce the amount you would need to take for your high blood pressure. So, and the bonus with activity and exercise is there's no side effects and it's free. So next slide. Next, there we go. So unfortunately, only 23% roughly of the adult population are meeting physical activity guidelines that are out there. And a lot of reasons contribute to this, such as sedentary occupations, more passive transportation, the way neighborhoods and things are built that we need to use transportation to get places. It's a little further to go to the store or places we need to go than a walk or a bike ride would be available to. Lack of parks or sidewalks, but in addition to lack of time and cost and resources for that support. Next slide. But the good news is it doesn't take a lot to start seeing benefits. Studies have shown that short bouts of physical activity, less than 10 minutes throughout the day, can be beneficial to your health. in short term as well as long term. So there's good ways to fit that in. So sometimes when people think, oh, I have to work out for 30 minutes or 60 minutes, you can do that in shorter bouts. So if you have 5 minutes to take a walk around the block or to fit something in and then do that again a little bit later in the day, as that time accumulates, the benefits will as well. And so finding little bits of time is really important, because in my motto is something's better than nothing. And it, again, will reduce those risks. It will set you up to be independent as we age. It will lower our risk for fall-related injuries and make us healthier as life goes on. Next slide. So some of the risk factors for falls includes muscle weakness, balance issues, gait problems, poor vision, which also attributes to your balance, limited mobility, range of motion in your joints and body's ability to move, maybe some cognitive impairment or postural problems as well. And all of these things can be worked on with activity and exercise. And I will pass that off on to my coworker, Alex, who will discuss the importance of balance and how you can work on that.
Next slide, please. So first of all, I just want to kind of take a step back and help everybody understand how complex balance in particular is. I think from an outside looking in perspective, a lot of people often will see balance as, oh, I just need to practice standing on one foot more. And it's way, way more complicated than that, because balance itself is a very complex topic. The definition really of balance is the ability to maintain that upright or chosen movement against the effects of gravity. And I also will point out kind of how I would define a fall, because that also is a common misconception. A fall is an unplanned descent toward the floor. So if you did not plan to go to the floor or into a bed or surface that you happen to fall into, if it was unplanned, that is a fall. So we want to, again, promote being able to maintain chosen postures against the effects of gravity. It is an interaction between the various sensory, cognitive processing, and motor systems of our body, which I will get into in a minute. And really, a lot of all of those systems are controlled and processed by our central nervous system. Next slide, please. So there's multiple facets of balance. There's a lot that goes into it. First of all, balance requires strength, specifically of the muscles of your lower body, your legs, your hips, your core in particular, in order to be able to transfer positions from like sitting to standing or laying down to standing, or to even just shift your weight from your right to your left foot. It takes the ability to stand up tall and have good posture. If you can't properly stack your joints in a vertical fashion, if it's very hard for you to stand up straight, it's going to be a lot harder for you to maintain balance, because you're constantly putting yourself in a position where you're just off balance. Then we need to kind of consider what each of our own individual limits of stability are. And really that refers to how far can you reach before you feel like you might fall? How far can you lean in a direction before you feel like you might fall? How big of a step can you take before you feel like you might have to fall? And when we get to that point, we need to do some sort of positional correction before we have that fall, or else we will find ourselves in an unplanned fashion on the floor. We want to think about our movement strategies. We need to be able to have the ability to anticipate balance challenges so that we can brace ourselves and possibly mitigate any falls. But we also need to have the ability to have reactionary skills and movements where we can correct our posture when jostled off balance, so that we don't have those falls. We need to be able to orient ourselves to our senses and receive information about our body's position and environment. I will get into those in a little bit more in a second, but the three main places where our brain gets information about our position are from our vision or our eyes, our vestibular system, which is our inner ear, and then our somatosensory system, which is your sense of touch, whether it's in your fingers, your feet, your legs, anything like that. And lastly, balance does require a significant level of cognitive processing. So when we do face cognitive impairments, whether it's due to illness or injury, that will ultimately affect our ability to balance long-term, because your brain needs to be able to take in all of that information that it's receiving, process it, and then send those motor neurons, fire those motor neurons to tell your muscles what to do. Next slide, please. So I said before I was going to get a little bit more into those three information systems. We use the somatosensory, the visual, and the vestibular system to give our brains information about our body's position relative to gravity and to our environment. This is, in healthy individuals, we will first orient ourselves perpendicularly to our surface that we are standing on. And when that surface becomes tilted or unstable, such as like if you're walking on sand, or you're standing on a soft surface like a pillow or a blanket, or even like kind of like a bumpy surface like you're out in a field or standing in grass, then we start orienting ourselves more to gravity. The somatosensory system gives our brain information about our position relative to the surface that we're standing on. So when we stand, we get information from like the bottoms of our feet. If we happen to have a chair or a counter to the sides of us, then we get information from our hand touching that surface as well. All that information feeds our brain good knowledge about our positioning. Vision system gives our brain information about our movement or our environment's movement relative to each other. So it tells us like when we're in motion or when we're not. And then our vestibular system gives our brain information about our head position and motion relative to gravity. Sometimes the vision system and the vestibular system come into conflict with each other. If you've ever been on any of those like what are they called? Those three-dimensional rides, I don't know, at Disney World or something like that, where you have the screen and the car kind of moves. There's this whole thing where people get very motion sick because they're perceiving a difference between like their environment moving and the vehicle actually moving. So that's one of the reasons that information coming to your brain comes in conflict, and you can kind of get that vertigo or that motion sickness pretty easily. Next slide, please. Then when we do get to the point where our ability to maintain our center of mass over our base of support becomes affected, we've gone beyond our center of base and we are about to have a fall, there are a few strategies that we automatically recruit in order to regain our positioning, our chosen position. And those are our ankle, hip, and step strategies. These are more or less automatic strategies, but it is important to note that if you aren't regularly practicing recruiting muscles of the ankle, muscles of the hip, or taking large type steps in multiple directions, or if you have a decreased amount of strength, or even, again, you have impaired cognition for one reason or another, all of these strategies and your ability to recover your balance if you're met with a challenge may still result in you falling because they aren't linking up correctly. So the ankle strategy is used with the muscles around the ankle joint, and it's for minor balance challenges. So imagine that you're on a boat, a very large boat, and there's a little bit of sway going on. Your ankle muscles are constantly firing to help you maintain that upright position. The hip strategy is when you get jostled a little bit more moderately, and it uses the muscles around your hip, your glutes, your core to help maintain our center of mass over our base of support. So that's going to be a rapid extension or flexion of our trunk at the hip, where you rapidly flex forward, or you throw your hips kind of out in front of you to help regain that center and bring it back over your base. And then the stepping strategy is when you completely kind of move beyond your base of support with your center of mass, and you need to kind of recover your center of mass over that base of support. So you end up taking a giant step to kind of widen your base of support to recover your upright and chosen positioning. So that might look like you're walking along on the sidewalk and your toe catches the raise in the sidewalk, and you end up taking this big giant lunge step forward to ultimately recover. That one in particular, I would say, takes the greatest degree of strength in order to be able to implement. It also takes the greatest degree of specific skill practice. So if you're not regularly practicing taking those big, large steps in multiple directions, you still might end up on the ground, even if your body tried to take that recovery step forward. Next slide, please. And then lastly, I just want to kind of go through that there are some simple ways that you can practice a variety of skills in your day-to-day life. You don't necessarily have to go to a class to improve your balance, and they can be incorporated. The guidelines out there are that you should be working on practicing balance-specific skills for 10 minutes every day. They do not have to be 10 straight minutes in a row. It can be 1 minute here, 1 minute there throughout the day, but it should be practiced for up to as little as 10 minutes per day, or minimum 10 minutes per day. So static balance is our ability to just kind of hold a position in place. One way you could incorporate that into your day-to-day life is standing on one foot or with one foot in the other, which is referred to as tandem stance, during everyday activities like brushing your teeth or waiting for the microwave or elevator. You could also stand on a folded towel or a small pillow if you wanted to add kind of that non-compliant surface and that balance challenge to your somatosensory system. Dynamic balance is when you're trying to maintain that chosen posture while your body is in motion. So you could do that by standing with your feet wide apart side to side, or 1 foot forward, 1 foot back with a large stance. And then you're working on shifting your body weight at least 70% or more into 1 foot and then shifting it into the other. You're just kind of doing some weight shifting. You could do that during TV commercial breaks or while you're waiting in line at the DMV or wherever else. And then another idea I have for you is to step on and off the stairs or curbs and forwards and sideways directions. You could try stepping over objects such as small shoe boxes in multiple directions. And you should always use sturdy support when you're practicing things like this, like railings and countertops as you need to. Strength exercises. It's a very simple way to increase your strengthening in your day-to-day life is every time you go to stand up from a chair, sit back down right away and then stand up, because you'll double how many squats you're doing every day. Incorporate a couple standing leg exercises, like a couple side leg raises or going up onto your tiptoes into your breakfast routine while you're waiting at the counter for the toaster to pop or something like that. And also you could always just seek professional support and guidance if you really don't know where to start. Lastly, you want to incorporate some dual tasking into your practice, where one that we all hopefully do a lot is just walking and talking. Recruit a friend and go out for a walk and have a good conversation. The ability to track the conversation while maintaining a good walking pace and gait is dual tasking. You could try marching in place while turning your head right and left at the same time. And if you wanted to make that even harder, you could try counting out loud by 3s while you're turning your head right and left and marching. You could try standing on 1 foot while writing the alphabet with the other foot. Those are all different things that are engaging your brain on different levels. I'm going to hand that back to Carla, and she's going to wrap up our piece.
Lots of information to process now, too. So coming back to what more can you do? So maybe start looking at what do you do on a day-to-day basis to begin with. And the easiest thing that we can do is move more. As you may have heard a while back, the sitting is the new smoking, kind of as far as the detrimental benefits, or they're not benefits, detrimental things that it can do to your body. We need to move more. And then, as Alex talked about, incorporating strength and balance exercises, also stretching to work on not just flexibility, but range of motion in your joints. You know, can I reach to comb the back of my hair? If I don't have good shoulder range of motion, I'm not going to be able to do that simple daily task. And then watching our diet as well, weight and things like that, and eating habits can then contribute to those health issues that I talked about earlier, as far as heart disease or blood pressure, and that all ties together. Next slide, please. So the current guidelines can feel or seem a bit overwhelming as far as what the details are out there. So what is out there is 150 minutes, which is 2.5 hours, up to 300 minutes or 5 hours of moderate intensity activity per week, or 75 minutes to 150 minutes, 1.25 to 1.5 hours of vigorous activity. So moderate is that you're breathing hard, but you could hold a conversation. As Alex says, you're out for a walk with a friend and you can maintain that conversation. You're not trying to catch your breath or feeling overly taxed. Whereas vigorous activity would be, I could talk, but I'm only getting a couple words out at a time. So obviously the higher intensity, you don't need to go as much, but incorporating a little bit of both throughout the week is good. It doesn't have to be all at once. Like I said earlier, a little bit is better than nothing. So see what your day brings. If you were like, oh, I meant to go for a 30-minute walk today, but I only can get 10 minutes in, 10 minutes is good. Go do that. Then at least 2 days a week of strengthening your muscles. So you want to do every other day, or at least a day of rest or a day of non-weight strengthening activities in between those workouts. So if you were to go to a gym, or in your house you have equipment there, a Monday, Thursday, or Tuesday, Friday, spread it out a little bit so that your body has time to recover from those strength training exercises. And as Alex talked about, activities to improve your balance, maybe if you are motivated by going with a group, it keeps you a little more accountable. Find a Tai Chi or yoga class or other types of balance focused classes to attend, in addition to maybe doing the routines on your own. Next slide. So getting started is kind of the biggest step. And the easiest things that we want to focus on are what motivates you, what would encourage you to get out and be more active. As Alex mentioned, multitask. So during a commercial break, or you're watching the news, practice your balance. Or if you have equipment at home, watch your favorite show while walking on a treadmill or riding a stationary bike. Or just hook up with a friend or your pet and take them for a walk. But also listen to your body, know where you're starting, and try not to do too much at once. We can all be really excited to get going, but it's always important to start slow and gradually increase, feeling like, oh, I could have done the next day, I could have done more, versus, oh, I did too much and now I have to take a step back. And like I was mentioning, don't discount the little things. Even if a few minutes here or there is going to pay off in the long run. Next slide, please. And we always encourage people to be assessed by a fitness professional, whether that's someone at a place that you belong to, or you can often find coaches out there just to get an assessment. And what that does for you is it provides you with some benchmarks. Where are your starting points? It gives you a clear idea. You can discuss, what do you want to accomplish? Is it more mobility? Is it more stamina? And then that way that person can devise a plan that suits you based on your health history. You know, what injuries are you dealing with, or have you dealt with in the past that maybe limits your range of motion or your mobility right now? Or do you have any chronic type problems that need to be considered when devising your plan? And that way then the duration, the exercises you start with, how frequent you do them will be considered when making a workout plan for you. And the strength training, again, like I talked about, 2 times a week, and having some degree of specificity that mimic and support the mechanics that you're trying to work on, as well as the goals you're trying to achieve. And then the aerobic activity up to 5 times per week. I'm always an advocate for 1 day of rest. But rest could be an easier activity, an easy walk, or a little bit of stretching, or 20 minutes of yoga or something like that. You're still being active, just not as structured and focused as other days during the week. And then again, we keep hammering home the balance exercises. And those can be also incorporated in your strength training plan. I often write workout plans for clients that I coach, and in fact, one of mine was at her gym working out, and she was doing arm curls standing on one leg. And a person came up and asked her, why are you standing on one leg? What are you doing that for? It's just an easy way to incorporate some balance on our body's awareness while doing some strength exercising. So that multitasking. Next slide. And I believe this wraps up our talk. So a lot of information we provided for you today. It can feel maybe a little overwhelming, but the takeaways are: move more, have a well-rounded plan, and just start slow and get moving. Thank you.
Thank you, Alex and Carla, for all of that great information. I was trying the standing on one leg and writing the alphabet while you were talking, and it's kind of difficult, but I like that one. It definitely challenges your balance. So thanks for sharing those great examples. All right, up next, we are going to have Ian Connors, who's a physical therapist with SSM Health. And Ian is going to share about fall and avoiding injury. So take it away, Ian.
Yeah, thank you. And I'll specifically relate that to pickleball. That's been a passion of mine, and I think the suggestions that Alex and Carla had of exercising more, as well as some of the kind of guidance for how to start an exercise program is also going to be something that I touch on a little bit here. I think pickleball is...
There isn't echo. I don't know if anyone else hears that. Is that just me? Okay. So I'm going to try muting you and then maybe unmute.
Can you hear me now?
I can hear you, but there is an echo still.
Ian, if you have another device next to you, is that muted? Because that may be the...
I don't have another device next to me. Is there... I have like another computer or...
Yeah, maybe let's try another computer. I'll skip ahead to my part, and then if you want to come back, that would be great. We'll try that.
Try that.
Yeah. All right. Sorry about the technical challenges, everyone. We tested it and it worked fine before, but you know, there's always something. I'm going to just skip ahead really quick and just briefly introduce myself. So I am Suzanne Morley. I'm a health promotion program coordinator with the Wisconsin Institute for Healthy Aging. And I also oversee our statewide Falls Free Wisconsin Coalition and our high-level evidence-based program for falls prevention called Stepping On. So I'm just going to share a little bit about falls in Wisconsin and then share a resource that we have available for falls prevention. We're here today talking about physical activity and falls prevention. So why is falls prevention so important? So I just wanted to share some data. Nationally, more than 1 in 4 older adults each year has a fall. Wisconsin does have the highest rate of injury-related death due to falls among older adults in the whole United States. So we have the most older adults that are having injuries and are dying due to those fall-related injuries. In 2022, over 47,000 older adults in Wisconsin went to the emergency department for a fall. And in that same year, emergency medical services providers in Wisconsin responded to over 130,000 falls in Wisconsin. So responding to individuals in their homes or at facilities that have fallen and assisting with lift assist. And that number that EMS responds to are increasing by nearly 10,000 a year statewide. So we know that the research shows and the data shows that this is a problem. Older adults are falling at an increased rate. The older adult population is growing as well. So that's why we're here today to talk a little bit more about that. So we do have a resource available. This just launched in fall of last year, and I'm going to share that. It's the Falls Free Wisconsin website. The link is just fallsfreewi.org. And I'm going to go through the website just briefly and share some of the things that you can find on the website for falls prevention. So on the home screen here, we have links to multiple different things. You can find a falls prevention program, like the Stepping On program that I mentioned, and links to other things throughout our website. There's some videos that you can find, and we have updates and newsletters that go out periodically that you can always look at. And this information is always getting updated. I'm going to highlight a couple of things here. So this top button, Prevent Falls, is where we have a lot of the information for older adults to learn about how to prevent falls as you age. So on this button here, this Learn Your Falls Risk, this goes to a falls assessment, and there's some quizzes here, conversations about falls, maybe how to talk to your provider or family members about falls, or your fear of falling or your risk of falling. reading other stories. So reading about other people throughout the state that have experienced falls and how it's impacted their lives. What do you do if you do fall? How to get up from a fall. There's a video for that. And again, I highlighted that Find a Falls Prevention Program. There's a number of different pages that you can go through as well. So you can find information about assistive devices, balance and strength, which we're talking about quite a bit here today, footwear, medications, vision, hearing, and your home surroundings. So I'm just going to click on this balance and strength page, since that is kind of the hot topic today, and show you some of the things that you'll find on some of these pages. We have videos throughout. So we have an interview here with a physical therapist on why exercise is so important. Guidelines like was just shared by Alex and Carla. There's stories from people throughout Wisconsin. And on here, you'll find some simple and balanced exercises, like some similar to the ones that were shared here that you can look through. These are very short videos that explain the exercise and you can practice at home. There's links to other things that may affect balance. You can see we talked about inner ear problems, vision. There's links to other websites, and same for strength. And there's some different resources too. So if you're wanting to start an exercise routine, you can use this exercise log. You can download and print this off. If you want just a printout of exercises, the videos that are available on the website, just an explanation of those, you can also go ahead and print those off. Lots of great resources available throughout this site here. The pages on this page here are pretty similar to what was just shown on the balance and strength page. There's videos, there's different handouts and resources that you can download and print, and lots of great information there. I also wanted to share this home safety challenge with everyone. So this is a real Wisconsin home that we took and we kind of staged with some fall hazards. Research does show that most falls happen at home, so it's really important to make some home safety modifications in addition to practicing balance and strength exercises. So I'm going to click on this, and hopefully my internet isn't too slow where you can see this. But if you click on it, you can go through this real home. It's interactive. You can move it around and find things that may be a fall hazard or ways to make your home safer. So just for example, here in this front porch area, you know, there's a cord going across that you'd want to make sure that you are making sure that you don't have cords in the walkways. Maybe you can add a railing to make it safer if you don't have a railing, or add 2 railings. Maybe you just have 1. You can add a double railing. Another example, an overhang might be helpful to protect from the rain and the snow that might prevent or might cause a fall, and different things like that. So you can see here, there's 58 total hazards and safety tips throughout the whole home. You can go through the entire house. You can go upstairs to the bathroom and a bedroom. You can go into the living room and the kitchen and find other things that may put you at risk for a fall. This cute little puppy here. You don't want to get rid of your puppy, but you know, they kind of tend to dart out sometimes and may put you at risk for a fall. So what can you do about some of the things that may be in your home? Again, you can go through this entire home safety challenge, but then you can also download a PDF checklist and find same things that are in that home safety challenge in a handout version. So you can use this checklist. Maybe you're doing some spring cleaning, go throughout your house and look at for some things that you may be able to do in your own home to make it safer. I'm going to go back to the website here just by clicking on that logo, that home button, and then that's how you make it back. But just wanted to share that great resource for everyone, so that everyone knows that that is available and you can look at that at any time. All right, I'm going to make my way back to the presentation. And Ian, do you want to come off mute, see if your audio is fixed now?
Can you hear me without the echo?
Sounds great. Perfect.
Okay, wonderful. So yeah, I was kind of restart here. Some of the suggestions that Carla and Alex had about kind of easing into an exercise program is also going to be important when you're starting a new sport. You know, the sport of pickleball has exploded in popularity, and I think it will continue to grow. I just recently heard that in 2028, they're going to have more pickleball players than tennis players. So it's something for all ages. And as far as getting activity, as far as something that's going to have those cognitive challenges where you're dual tasking, that are going to challenge your limits of stability, pickleball has it all, in addition to, I think, some other ways to take care of our health and being in relation with other people, being involved in the community. It really has so many wonderful aspects about it. But today I want to talk about some common injuries that you might see related to pickleball, as well as what you can do to prevent those injuries so that you can stay healthy while trying to stay active. So next slide. So common pickleball injuries, kind of breaking it down into a few categories. There's overuse injuries with tennis elbow. Even though it's called tennis elbow, that's kind of the common name in our society. It's oftentimes from kind of repetitive gripping and micro trauma that can occur in one of the compartments in the forearm. That is, again, common in pickleball when you're holding a paddle, especially if you're holding it too tight. Rotator cuff issues can be common because of the repetitive swinging motions, especially overhead motions if you have some previous injuries before. Your Achilles tendon can also get irritated by, especially if you're starting a sport for the first time in a while, being on a hard surface, having those kind of explosive, quick steps on the court can be irritating for your Achilles tendon. So those are kind of structures that in your body that you want to watch out for. As far as pre-existing conditions, if you have arthritis, if you know that you have some kind of chronic nagging issues from old strains or sprains, just kind of other areas in your body that are a bit more sensitive, you want to make sure that you're taking those into consideration, giving yourself a little extra care while either warming up or making sure that you're seeing a therapist or seeing a professional to have those be in kind of top-notch shape before jumping into a new sport. There's also acute injuries. So falls are a very real thing, especially as people get older. And fractures are oftentimes a result of a fall, something that absolutely can occur in pickleball, and you need to watch out for. So strains and sprains, those can occur in all the different muscles or kind of musculotendinous junctions in our body, just by having a quick movement or, again, kind of a constant repetitive motion. Eye injuries have become more common in pickleball lately as the paddle technology has advanced. The paddles have become faster, a little bit more powerful. Although it's not the most common now, people have started to wear eyeglasses when playing pickleball. So next slide. Things that you can do to avoid getting those injuries and avoid end up on the ground like the person on the slide there. But one of the things I'll say just as a caveat, make sure that you talk to your doctor if you have heart conditions, if you have kind of health conditions that are not managed well and might be a concern for you exercising or exerting yourself. You want to make sure that when to stop or if you should be exercising in a more strenuous way. So train up and ease into it. All right. Just as Alex and Carla had said, do some of the motions that you are going to be doing in the sport beforehand. You don't want to be jumping in and playing for 2 hours because it's a nice day, your friends and family are out there. You really want to be respecting your body and kind of easing into it. And that might be 20 minutes, and then you take a break and play for another 20 minutes with some rest breaks in between. As well as, you shouldn't be trying to be a hero as well on the court. You might have had your days where you felt more like an athlete, and you overextend yourself. You want to make sure that you don't do that. So don't be overdoing it. That could look like playing for 3 hours when it's hot. There's lots of different ways of overdoing it. So you want to make sure that you're respecting your body, especially with it being summertime and you might be considering playing pickleball now that the weather's nicer. You want to make sure that you're hydrating, so that you have a good way of cooling your body when you're sweating. and avoiding dehydration, avoid getting lightheaded or dizzy on the court. Having proper equipment is really important. And equipment can look like the paddle, right? So especially if you get into the sport, having the appropriate paddle for you, in the sense that heavier paddles are going to be a little bit harder on the shoulder. Having appropriate grip circumference can make it easier on some of the muscles in the forearm. So you want to make sure that you have the correct paddle if you are going to be playing this on a very regular basis. Other things related to equipment, I mentioned the eyeglasses, just kind of safety glasses. Some people play with their regular glasses. All that can kind of prevent eye injuries, especially you do get up to what we call the kitchen line, where you're about 14 feet apart oftentimes, and you sometimes just don't have time to react and get out of the way to prevent getting hit. Having proper shoes on the court is also really important. I would highly recommend having some shoes that are specifically designed for courts. So not like running shoes, not flip-flops, not sandals. Really should be, you might hear a dinging noise here. Having shoes that are designed for courts, normally they provide balance of traction and the ability to slide and shuffle. Hold on, I'm gonna mute myself briefly here. Sorry, everyone. I'm doing this from the hospital. We just had the overhead speakers of the hospital go off, so pardon me there. Other equipment is making sure that you also have, braces if you're wearing braces to keep your joints healthy, and having clothes that you can move around in a court, where you can stretch, where you can lunge, where you can do a lot of motions that you'll need to do on the pickleball court. Making sure that you're doing a proper warm-up, breaking that up into kind of 3 components. A general warm-up where you're getting your body temperature elevated. This can sometimes be incorporated into what we call a sport-specific warm-up, where you might be kind of practicing some of the shots that you're going to do when playing a pickleball game. That kind of prepares your body for the motions rather than kind of going into it cold. You both prepare the pickleball motions and you get your body temperature up before you're actually jumping into a game. That can lead to some intensity right away. The other thing is a dynamic warm-up, where you're going through, again, the kind of body motions. You might be stretching your arms, doing some lunging motions, some dynamic motions where you're kind of going down and touching your toes, all before playing. Learning pickleball strategy also can be important, especially when you play at a even mildly competitive stage. The aim of the game oftentimes is to get your opponent off balance, which sounds silly, but that's a way you can force errors and kind of get the advantage. So making sure that you understand the strategy. The court actually is pretty small, and you can kind of cut off angles and minimize how much you're moving, how much you're having to kind of run backwards, just by understanding the strategy of the game. So that's something that, having a lesson, having someone coach you that's familiar with the game can be really helpful for as well. Understanding the proper technique of the swings, right? Especially if you have issues in your arm. If you don't have the proper technique, oftentimes you can either overuse something, or just like I mentioned in gripping the paddle, sometimes you can irritate your forearm muscles by gripping too tightly, even though kind of the proper technique is often having a lighter, looser grip where you can feel the ball and paddle a bit more. So there's a lot that goes into that. I won't go into everything there as well. Listening to your body can also be really important. Your body has a lot of wisdom. Oftentimes people have a sense of, is this an injury, or is this soreness that I'm able to push through a bit, or that I think will get better with a little time. Oftentimes people do have a sense of when they probably should stop, if they're getting tired, if they notice that their form is sacrificing, if they're scuffing their feet on the court. All of that is kind of an indicator to listen to your body and stop and take a rest break or stop for the day. And one last thing I think is important to mention, having an AED or a defibrillator, as well as someone that knows how to do CPR, in the instances, and I'll say the rare instances that people with heart conditions, have issues, then having those skills and tools on the court can be also a really helpful thing. I know more courts have begun to do that and incorporate it as well. Oh, and one thing I just realized I skipped over is the environmental conditions. If you get things, you want to take stock of what the court looks like. If the court is wet, you really shouldn't be playing on it. If there's just a few spots, bring a towel, kind of dry it off before you play as you're warming up. If there's debris on the court as well, having a blower, having a broom, things like that can also really reduce your risk of falling, of having something unexpected happen as well. So I don't mean to scare anyone by kind of having all these things that you need to do in order to prepare. But if you are worried about falling, if you're worried about your balance, these are all things that you can do to just get yourself a little bit safer, to make sure that you can stay active for a long time. So I think pickleball is an absolutely wonderful sport to get into. So thank you.
Thank you, Ian. I haven't personally tried pickleball yet. I'm not a big sports girl, but it seems like a lot of fun. And when I see people doing it at the YMCA, it looks like they're having a blast and definitely breaking a sweat. So thank you for all of your guidance on how to avoid injury and do that safely. Well, we have some time now for some Q&A. So for our speakers, for Ian and Carla and Alex and myself, if anyone does have any questions related to falls prevention or safely doing physical activity and preventing injuries, you can either feel free to put those questions in the chat or come off of mute. This question here in the chat, can the slides be shared? Great information. So yes, we will send out a recording of this webinar sometime, hopefully later today, if not by early next week, and we'll share the slides with that as well. Just give another minute or so if there's any questions, definitely feel free to ask them. I think there was a lot of great information shared, and it's not just balance, it's not just strength, but Ian also mentioned footwear and the proper clothing and warming up and different things like that. Super important for falls prevention. Okay, well, not seeing any questions, so I'm just going to move on and wrap up. So we do have a short survey that we will ask that you fill out. Link is on the screen, and Erin, if you could drop that in the chat as well, that would be fantastic for everyone to click on and go to. And if you do fill out that survey, you do have the chance to be entered to win a set of pickleball rackets, courtesy of our sponsor, Firefly Real Estate. So the ones shown on the screen, they look pretty cool. Those are the exact ones that you would have a chance of winning. So if you haven't started doing pickleball or playing pickleball and you've been wanting to do that, or maybe you are a regular pickleball player and you need a new set of rackets, you do have the chance to win a set and provide us with some feedback. So definitely appreciate your feedback for this webinar. Want to end by sharing that we do have an upcoming webinar for our Age Well series. That one is coming up on June 12th at 1 p.m. And it's about the mind-body connection. So how metabolic health contributes to brain health. You can pull out your phone and snap a picture of that QR code to register. And the link for that is on the screen too. And all of this information will be shared in the email that goes out post-webinar with the webinar recording and slides as well. With that, I will wrap up and thank you everyone for attending our webinar today for WEHA's Age Well series. Have a great rest of your day.
Thanks, everyone.
Thank you.